Hey, this is Jermaine Thomas, your host of Urban Conservative News, providing you commentary and analysis on the stories that's dominating our news cycle. And that story that I'm going to give you a brief analysis on is repealing and replacing Obamacare, which is set to take place tomorrow by the GOP in the House, and the bill will be passed and will go on to the Senate. And I believe that they will pass it, and um, Trump will sign it into law. There is a lot of political capital plan on this bill being passed for the Republicans, and so I believe that they will capitalize on that political capital because a lot of people in their party and their base are expecting them um, to provide some type of measures and relief for those who are suffering high premiums under Obamacare, people who don't like the idea of being forced to pay a tax because they opted out of, and being penalized because they opted out of Obamacare. Um, People like pre-existing conditions, people like your child being able to stay on your health care plan to their 26. I'm not saying that health care doesn't need to be reformed. There does need to be real reform. But I think that the larger issue here is the health insurers, the health insurance companies who are only out for money. And we're a free market society, so that idea and premise of business and making money is not a shocking notion. So we do need federal government to come in and to regulate some of that, I believe, and the high cost of pharmaceutical drugs and the pharmaceutical companies that are in the business of making money as well. And so I don't see nothing wrong with the federal government coming in and providing some type of regulation and relief, or negotiating or incentivizing pharmaceutical companies to offer cheaper medication, and at the same time have the opportunity to make money. The same thing with insurance companies having the opportunity to provide coverage, ideally and being incentivized to provide coverage for those with pre-existing conditions, or those who don't have insurance, and the government providing subsidizing those things. But you know what tends to happen when we think about free and the federal government, at least this is what I think about, is that there's nothing free when it comes to the federal government. Somebody has to pay for that. And not just somebody paying for that, and who usually pays for that is the middle income workers. We carry the burden of taxes more than any other income class. And another ideal is that free. When it comes to free with the federal government, to me, philosophically, there's certain liberties that a person gives up when you receive something free from the federal government. For example, Section 8. And I'm not arguing against Section 8 or anything like that. If you're going to use it as a tool, but not as a means to an end. But with versus having your own home and owning your own home versus Section 8, you can't leave it as inheritance, number one. But number two, that there's certain oversight because of the federal subsidized program, certain rules and obligations that you have to abide by. So if your child commit a felony crime, or your boyfriend or whatever, they can't live with you, or they can't stay with you. Now, if you had owned your own home and your child committed a federal crime, a felony or whatever, and they serve their time, and they can come live with you without any federal oversight or influence in your affairs. So when you have the federal government running your health care, there's certain oversight and mandates that they require. What they're going to cover. Some people float around the idea of death panels, and the government deciding on what they're going to cover, what they're not going to cover. There's a moral argument to be made against universal health care. Ideally, that happened under Obamacare, like gender reassignment surgery, that was covered under Obamacare, and doctors, let's say they're a doctor who morally they're Christian, don't believe in that, and so they're being forced under Obamacare to provide these types of surgeries, or abortion being uh, 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 federally funded, and expanded under Obamacare. And so morally, there's a problem with that. People make an argument against that morally, or uh, violate their moral conscience and being forced to pay for that. So there's like Hobby Lobby had their lawsuit against the federal government being forced to provide contraceptives. Small businesses were forced to or mandated by the federal government to pay for health insurance for the employees. And then if you have a small mom and pop shop, and they have to provide health coverage according to the mandates that Obamacare required, and then forcing people into a healthcare system. You get all these people into this health exchange system that was never there before. Where you gonna find the doctors to treat these people? The quality of healthcare goes down. The time and wait for services goes up because there's not enough doctors to meet the needs of those people being flooded into the system. And then financially, it was doomed to fail from the start. That you put all these people into the system, but you got all these people taken from this system, but not enough people putting into the system, and that's what they was hoping, that a lot of young people would flood into Obamacare, and that did not happen. So you can read a lot of articles, whether they're conservative, liberal articles, on why Obamacare was doomed to fail and why it has failed. And even now today, many health insurance companies are pulling out of the health exchanges because there's no kickback or benefit for them to be in there in the first place. So that doesn't mean that healthcare shouldn't be reformed. It should. I'm not arguing against pre-existing conditions. I think that's ideal. But the whole notion in my philosophical argument is the federal government forcing you to buy a product. That's like iPhones. There's many phones out there, but the federal government says, well, there's a lot of phones out there. Yeah, there's a lot of phones, but we are mandating you to buy only iPhones. And so, in principle, that's kind of what Obamacare does, is it mandates you to buy the specific healthcare coverage and plan. And Obama made the promise that if you like your doctor, you keep your doctor, and that didn't happen for a lot of people, and premiums are skyrocketing. And then you think about those that maybe work for an employer, who don't, small employer who is exempted from Obamacare, and they make just a little bit over the threshold, and so they can't get in to get all the subsidies that Obamacare offered to people who have no income, and so they're stuck. So the system was rigged for those that are. The system was rigged against those that were healthy, and penalized those that were healthy and had money. Nobody's against taking care of the sick and the poor among us. There's an emotional argument that can be made for health coverage for people who needs it and don't have the money for it. But there's different means and methods that we can do to incentivize companies to cover people like that, or insurance companies and things like that. So that's my argument. You can challenge me. We can debate the issue. Repeal and replace is something that's needed. Democrats not going to touch it because Obama's name is on it, but they know it's a failing system, and go beyond the political rhetoric. Research, study yourself. That's if anybody watched my videos or heard me speak on political issues, that's even though I may be a conservative and or I have libertarian views, or I support certain positions that Trump has on certain issues. But I tell you, I'll be the first to tell you to go beyond the night show comedians, go beyond the media talking heads, and research and look at things yourself and gain a perspective. and be an informed voter, be an informed citizen about the issues and the dictates and the policies that our federal government proposes that's going to eventually affect your life, the life of your children, and the life of your children's children to come. So, be informed on the issues, and that's all I'm trying to do is provide you a breakdown analysis on the things that's dominating our headlines. So from time to time, you hear me chiming in, giving you urban conservative news, providing analysis and commentary on headlines that's dominating our news cycle. If this makes sense to you and you like these type of videos or whatever, man, just shoot me a comment in my comment section. Take time to watch the video, provide a comment, a question, a debate. Definitely debate on the matter. I don't back down from healthy debates are good. As long as they're healthy and they're educational, we can learn from each other. I'm open minded to learn. But ideally, philosophically, I think the government forcing us to buy a product such as health insurance is philosophically and fundamentally flawed. Thank you for tuning in, and look for other videos. God bless. Peace out.